Good afternoon. My name's Dr. William Addison and I work at Cosmos Clinic in Sydney. And today I'm going to talk to you about MyEllevate, which is a Cynosure product. It's a polyester permanent thread that we usually use in conjunction with neck liposuction to enhance jawline contouring. So it's a 5-step procedure. So first of all, we need to locate and divide the platysmal bands. And then we make a small incision and infiltrate tumescent anaesthesia, and this is to separate the subdermis from the underlying structures. And then we use liposuction to tunnel and break apart the space. And then lastly, we insert the MyEllevate suture. So this is what comes in the kit. So we have a clearing tool and a puncturing tool, and that's to make the incision points for the suture rod to put the suture in place. And we also have a light guide, which is really good for making sure that we're in the correct tissue plane. So just to confirm, we're mainly working in the submental and the submandibular triangles here below the jawline. And this is usually used in conjunction with liposuction. So what I'll do now is I'll go through patient selection, and then I'll talk a little bit about each of the 5 steps in a bit more detail. And then I'll go through some post-operative care instructions and then some before and after photos for you guys. So I do quite a lot of jaw shaping and neck liposuction, probably a few people a week, but there are certain clients that I have to turn away because they're too heavy in the lower jowl area, and I can see the platysmal bands. So this is really good for people that have sort of heaviness underneath the fat tissue. So a good candidate will have some form of fat tissue in the submental area. They'll have platysmal banding that is usually visible, and they'll also have decent skin elasticity, so their skin can't be too excessive or too thin. So for step 1, division of the platysmal bands, as we age, the platysmal bands become a little bit more obvious. This usually happens around the age of 35 to 40, and there's a few different schools of thought as to why this happens, but generally speaking, most people think it's related to relaxation of the skin and the muscle itself. So most repairing techniques are skin tightening and strengthening the muscle. But there is some growing evidence to say that the muscle actually moves differently under the skin as we age. So to start, what we do is we locate the platysma and we lift it and then mark about 1 centimetre on either side, on both sides of the neck. And we use the puncturing tool and the clearing tool to actually separate the muscle. And this just helps us lift it later on. And then step 2 is the infiltration of tumescent anaesthesia. So we make a very small submental incision. Most of you are aware that tumescent anaesthesia is essentially sodium chloride with some lignocaine, some adrenaline and some bicarb. So it's good for hemostasis during the procedure, and it's also really good for post-operative pain relief for the patient. We usually put in about 250 ml approximately, and that really expands the space and creates an area for us to place the thread. Now, step 3 is tunnelling. Now, this is for people who may not have access to energy-assistant lipomachinery like laser or vaser or ultrasound liposuction. So this is more so traditional liposuction equipment that you need. It's usually done with a 14-gauge spatulated lipo cannula, and you're just basically tunnelling in the area and just creating a space, once again, to lift with the suture. If you do have access to energy-assisted lipo, and I exclusively do vaser or ultrasound liposuction, then step 4 is probably more appropriate. What we can do with ultrasound is we can melt the fat, and it makes it easier to remove, and it's less trauma to the patient and post-operative swelling. And we can also use it to kick off the collagen that's still in the skin and tighten the skin to some extent. So I usually do this after vaser liposuction. And then the last step, step 5, is actually the placement of the MyEllevate suture. So what we do is we position with the patient with a hyperextended neck, so it's always good to place like a towel between the shoulder blades. And once you're in position, we mark out or map out 8 points, and it's the same on every patient, so it's very consistent, that we're going to use to actually thread the thread through in a sequence. So then we use the puncturing tool and the clearing tool, which come in the kit, to puncture a hole and then sort of undermine around that hole, and this is just for easy manoeuvring of the suture rod. The next step is to actually put the suture in place. So there is a light guide which connects, and what that does is it allows us to make sure that we're in the correct tissue plane. So if the light is quite white, it means you're too superficial. If it's red or pinkish in colour, you may be too deep, getting down towards the muscle layer. If it's an amber colour, then that means you're in the right sort of tissue plane. So it's very sort of user intuitive, and you can make sure you're placing it in the correct position. And then we just follow the sequence of numbers, so 1 to 2 and 3 and so on. This is probably the most important step in the whole procedure, and this is anchoring the thread to the mastoid process. So when we get to this area, we go a little bit deeper and we're going to the superficial fascia or to the retaining ligaments. We really want to engage them and use them as the anchoring point. This forms the whole backbone to the sling that we're going to put in place, so it's very important to do this part correctly. Once we do that, we then make our way back under the mandibular angle and back to the central part of the chin, and that's where we pull the suture rod out, and we're about halfway through the process at this point. And this is where it's good to test your anchoring, so you put a fair bit of tension on the suture from both ends, and we really want to make sure that we've anchored on that mastoid process effectively. If you haven't, you can tell pretty much straight away, and you need to remove it and redo it, because otherwise you can end up with a fairly common complication, which is movement of the suture, which can become visible. We then repeat the process on the other side of the neck, so once again spending a fair bit of time anchoring to the mastoid process on the opposite side, and eventually the suture will exit from the same point that we started, and you can tie it off with some half knots, and then you can use the equipment to actually bury that knot down in the subcutaneous area to make sure it's not visible and decrease the risk of infection. It's a good time to sort of make sure that everything is symmetrical and that you're happy with the suture placement. After these procedures, neck liposuction and placement of the suture, I always send people home with a facial garment and get them to wear it for 72 hours full time. This is really important to get the skin to sort of set into its new position and also to decrease the amount of swelling. Some people also like to use a neck brace, and this is mainly for people who work sitting at a desk, just to decrease that movement and make sure the skin doesn't move in the first 3 days. Other post-operative things to think of is just getting people to sleep at a 45-degree angle just for swelling and for drainage of the swelling fluid. And you can get people to intermittently ice the area over the first 72 hours as well, providing they put a barrier between the treatment zone and the ice. And most importantly, if you're doing this on a male patient, then they can't shave for about 10 days after it, because we don't want to knock the head off any of those little incision points and create a risk of infection. So now for some before and after shots. This isn't my photo, this is from the US. I put this one in here because it's a suture placement without energy assistant liposuction. So this person hasn't used Vaser, they use traditional lipo. And what we can see is the skin tethering in the submental area is almost completely gone on day 1. You do have a little bit of tethering left, but that will resolve about 6 weeks after the procedure, and there's not much swelling or bruising. So this is, a sort of a fast turnaround in terms of people who don't have much downtime. To compare it to what I usually do, which is Vaser liposuction and then placement of the thread, you're going to get a bit more swelling and bruising. So this is at day 2 in a lady in her early 40s. As you can see, the tethering under the sort of mental area there is almost completely gone, but it does exist a little bit sort of laterally there. You can also see that there's some bruising tracking down into the lower neck, and this will sort of stay above the clavicular line, but it's going to be there for about 5 to 7 days. So in these people, I always say to allow about a week off. And then this final picture is a similar sort of lady who is 2 weeks post-op, and she had Vaser liposuction and placement of MyEllevate. And as you can see, the tethering under the mental area is completely gone, and so there's a swelling and bruising. So this person will be okay to go back to work. Garment was also off at this stage. So just in summary, MyEllevate is a new type of permanent thread that's usually used in conjunction with liposuction to really sculpt the jawline in a particular type of patient. In my experience, it works really well in people that have sort of prominent platysmal bands and some submental fat that needs removing, and also people that have a decent elasticity content in their skin. So people that have really thin skin or a lot of excess skin are probably more likely to go for a lower facelift, but this sort of bridges the gap in between liposuction and facelifting. And that's it. Any questions? Thank you.